My name is Dr. Todd Davis, and I am a dentist at Dental Care at Bixby. You can see we got some fractured teeth here, so one of the main reasons we want to remake Harry's denture for him. Go ahead and open for me here. And bite together again. I got a nice stable bite, so that's going to help us. It looks like their borders are pretty decent, so I don't really think we need to border mold this case. We'll just do a wash. And go ahead and open. And then we're going to kind of take a look at the fit. Fit's pretty good. So when the fit's pretty decent, I'll generally do a light body impression material. If it's really unstable and it's wobbly, I'll do medium bodied. Just tends to work better for me. Just taking a look at his ridge. No pathology, everything looks healthy here. All right, so we're gonna go ahead and put this back in. And one of the things we found with the impression process is sometimes that material set or you get too much in there. So we like to mark our VDO ahead of time. Hey, I'm just going to make a couple marks on your face and we'll wipe them off after, okay? Just to do a dot there. One there. I just need to get a cotton tip applicator. This is my favorite way to do it. Just make one mark on there. I'm gonna line that up with the nose. And are you biting together, Harry? Perfect. See, just like that. Okay, so now we know where Harry's VDO is. So we're gonna go ahead and take this guy out. And you get that denture nice and dry. Now, I don't use adhesive on the upper. I will use it on the lower. Typically this locks into the undercut just fine. So this is a regular set light body impression material. I'm going to go ahead and bleed it a bit. I'll fill in that tray nice and even here. All right, here comes that goo, okay? I want to make sure we're lining it up with the midline. And try to catch as much as we can. We'll go down Harry's throat there. Make sure it's seated a little extra. But we got some coming. All right, that's gonna sit out there. Go ahead and bite. Good. That your normal bite? All right, then we're just gonna double check here. Okay, so we can see we've opened them just a bit. Now there is gonna be some thickness to that impression material, so you're always gonna have a little bit of increase in VDO. And we'll take a look at Harry's denture, and he does have quite a bit of wear on those posterior teeth. So opening a couple millimeters is probably going to lead to a better result to compensate for that wear anyway. So I'm happy with this. Now, if we're looking at this, and that bottom mark was about here, then we know we got a big issue. We opened them up way too much. So I would say at this point, or probably a couple millimeters, which Harry will adapt to because that's where he previously was. So I just like double checking that. But we're gonna let that set up for a while. I used to use a fast set. We found we had more errors with that getting set up before we had it fully positioned in the mouth. So I have reverted to a regular set. It takes a little bit longer, but I think it's just a little more predictable. Some patients, we get into the middle of telling a story and we have that in our hand and it's setting up and that time clock is clicking. So with the regular body, we just got a little more leeway. Oh, we got it way down there, sorry. Okay, as you can see, the light body's a little trickier to work with. I do like medium, and we got great suction. You all right?
Oh, yeah.
Okay, that felt...
I am now. You're now.
Yeah, now you... it felt pretty good in there. Feel nice and firm to you?
Mm-hmm. Yeah, it was tight.
Good. Okay, so this is our impression. It looks pretty darn good. We got some nice front end attachments there. But we did, unfortunately, go a little bit down Harry's throat, and we got a lot of excess. So something like this, it's not going to skin. It's going to be caught in different positions with that Itero, so we need to trim this up. So I like using a 15 blade. Let's go around. Wherever there's anything real movable, that's going to have to go. You can see that's nice and firm, and we got a little extra extension there. Now on the palette, I'm going to clean that up too. That'd actually probably help us scan. I might leave that there. But on top of the teeth, that definitely has to go. So we're going to go ahead and cut all this excess off. We want to see all the teeth if we can. And come back here. I might have to get rid of that on the palette. Rico, would you be upset if he got a scan with all this on the palette?
On the palette, it's not as bad, but on the teeth, it would be a problem.
Yeah, on the teeth for sure. I think that might help us scan, actually. Yeah, we should lean it up through the video.
I mean, if it helps to scan and it works, we should be fine.
All right.
Because we can flatten that out.
Yeah.
But that actually shows, so your video is slightly up and you had some material there. So that would actually justify why that was.
Why we're off a little bit.
It's so slight and we want to make that up anyway, we'll be fine.
Yeah, let's look at that. I mean, as you can see, we got a lot of wear on these posterior teeth. We even got a crack coming down here. Same here. Now, we did open them up a couple millimeters as we saw. That's going to compensate for a lot of this wear. So that's why I didn't get too upset about that. Now I do want to trim some of this up. It's a little movable. Just real careful to try to leave anything that's going to help with the retention. I think we're looking pretty good there. So we have nothing loose, movable. We're ready to scan. Okay, so first we want to set up our menu. Right now we're on study model iRecord. With Itero, we want to be under denture removable. This is going to turn off the AI. We don't want the AI on when we're doing this. Now we have a denture, so we're going to go full denture tissue base. We'll get the shade in a bit here, and then we're going to go to final finish. A new sleeve. Then we're going to put in some really good notes later. We're going to select the upper denture. That's all we're doing. And then we're going to select our lab. We're going to Synergy. And we'll complete the rest later. Gonna take off this plastic. All right, now I'm going to go to the scanning icon here. But what I want to point out, a couple things. I'm going to hold this in the palm of my hand like this. Now, I am not going to move my hand at all. My hand should be steady. Now, I did leave this PVS on the palette. It's going to actually help us scan, and the lab's going to be able to flatten that out without any issues. We don't want anything on the teeth. And we want to be able to see all the teeth. So you can see we clean that up just where we want it. I always start on the second molar. Doesn't matter which side. We're going to go all the way around. So we're going to go ahead and hit our button. We're going to pick up that tooth, and I'm going to rock back all the way to the posterior aspect of the phalange. And now while I'm doing this, I'm focusing mostly on the occlusal aspect of the teeth, but I'm also going to cheat and get a little bit of the palate. The palate can be challenging, so this is going to help me when I go to come back and get the palate. And slow and steady wins the race with the Itero. You can see I'm not rushing this. Now I'm to the other posterior aspect. I'm just going to walk my way around, and I'm going to stay in contact the entire time. And it is catching some of my glove, and that's totally fine. So that's our first step. And we can take a look here. And we did pretty good. Now we're going to come back and get the buccal aspect later, but right now we're going to focus on getting the palate. So we're going to go to 8 and 9 here. Let the scanner recognize where it is, and we're just going to kind of wave it down. We'll go all the way to the posterior. Good. Okay, so now we got that palate. That's everything we wanted to capture. Now I didn't get these undercuts on the PVS, doesn't matter. The lab's going to smooth that all out anyway. Now, at no point have I hit this button. You can see it's just flashing in space. That's totally fine. If you hit the button, we're going to have issues. I'll let you know when to do that. So now we're done with this handhold. For me, I'm going to go ahead and hold it in my forefinger and thumb. Doesn't matter which way. But now we're going to get the buccal of the teeth and the extent of the borders and flange. So I'm going to go to a tooth. Remember, the scanner likes teeth. And then I'm going to roll over. And then I'm going to go to the extent of the phalange and just a nice W. I'm going to work my way all the way to that midline. So I've made it to the central, and now it's getting a little awkward for my hand, so I didn't hit the button. We're still scanning in space. I'm just going to flip that denture over. We're going to go to the other second molar. Scanner recognizes where it is. We're going to work our way down here. Scanner's behaving really well for us today. It likes this light body wash. All right, and that's what we're looking to accomplish. And so at this point, everything's looking really good on that occlusal cameo aspect. So at this point, I'm going to hit the button here, okay? Now, one thing I did mess up, you can see I scanned on the lower. We should have been doing this on the upper, but it'll still work for us. And we're going to do the intaglio scan exactly how we did the occlusal scan. So we're going to start on the posterior ridge here. We're going to hit that button, and you're going to see a new scan emerge on the screen, and that's fine. Our old one's down in the corner there. We're going to work our way around, a nice horseshoe here. Then we're going to come back around the posterior palatal seal. That's what we're looking for. So that's the first scan segment we want to do. You can see we got a lot of missing data. We're going to collect that next, but let's finish that palate there. So for this, you can go to 8 and 9 or the posterior. I got more. Well, let's see here. It's going to like that better. Okay. We're just going to collect all that data. Okay, so we got the palate really well. Now we're going to work on capturing all the undercuts in the phalange. So I'm going to go back to where we started. Always go back to home, something the scanner recognizes. We're going to slowly work our way around. And I'm back to holding that denture flat in my hand here. I'm going to cheat a little bit, try to get some of those undercuts by angling that wand. You can see I lost it. Okay, it's coming back. You just got to let it think sometimes. Coming back around. Okay, let's take a look. One thing a lot of doctors miss is this maxillary interior. And see the blue areas, we don't have that data fully captured. So I'm going to go back and see if I can get that. I'm going to change my handhold so I can get the wand a little bit at a better orientation. So we're going to start back here. Yeah, the scanner likes that. we're gonna kind of roll and try to get that tip of that wand in there. You can see it's getting that data down where we need it. And that last little portion. Okay, so we filled in all those blue areas. Looking really good there. So now it's time to get the two scans to mesh together. So when I do that, I look at the denture and I try to find the area where the flange is the shortest. So I'm liking this area right here. So I'm going to get a nice roll to the tooth. So the area where it's shortest amount of flange. So we're going to go back to where the scanner recognizes, and we're just going to roll. It didn't like that. Nice little roll. There we go. Now we're seeing teeth. Remember that scanner likes teeth, so we're going to keep going on this trajectory, and we should see those two scans combined in just a second here. There we go. And you see those two magically came together, and we can take a look at our scan. Got a little bit of my glove there, that's fine. The lab can clean that up. I do want to get that palette just a little better, not an integral area here because we did capture the extent of the impression, but we just want to give the lab the best we can. I'm going to come back on the end here where the scanner recognizes. There we go. Okay, so we'll take another look. And that is looking like a great scan to me. I'm going to go ahead and click the button. So we're going to go to the next art scan.
Stay just like that, okay? All right, right down for me, and I want you to stay just like that, okay?
Okay.
Keep those lips relaxed. Okay, don't move. We're gonna go to the other side.
Okay, yeah, I don't think we want to change the midline. I think he's displaying a nice amount of teeth, too. Everything looks pretty good. All right, so we're going to check the scan now. I'm toggling off the color so we can get a better idea of what we're looking at. You can see we have absolutely no voids, captured the flanges, the borders really well. Our bite looks right too. This is what we're seeing in Harry's mouth, so that's also important to check. And I like using the occlusal clearance tool for this, making sure we got pretty even marks throughout, so everything lines up with what we're seeing in the mouth there. On the occlusal, oh sorry, we scanned it upside down, but our lab will still figure that out. We've got everything we need, and like I said, they'll smooth out that palate. We can have little boys on the palate. It's not touching any soft or hard tissue, so this is a great looking scan. We're gonna go back. Okay, so we're gonna go ahead and pick Vita. Harry's a B1. He likes that shade. We're going to go with our normal light pink. Into the lab, take the shade. And then we're going to put some nice instructions here. Okay, so we're not making a lot of changes. We're redoing this just because all the broken teeth and the wear on Harry's denture. So I'm not giving any instructions to shift the midline, or just can't, because those all look really good on Harry's denture. Now, I don't normally request a digital mock-up, but if you're just getting started with this, I think it'll help build some confidence on the final product that you're going to receive. So the lab can show you what they're going to do to adjust Harry's denture digitally. You can always get a 3D printed try-in, but we found that most of the time it's not needed, especially for a straightforward case like Harry's. So I do it on ones where I'm going to make really large changes in BDO, or we have some pretty drastic changes in gingival display or cant. But for most cases, I don't request the mock-up, but I am going to, in this case, just for educational purposes. So we have everything we need here. We just need to upload those pictures to myitero.com. It's nice having that all in a nice package for the lab. Now, I will note that if you don't reference the photos in the scan, the lab's not going to get them. They'll be in that package, but a lot of times they won't open them. They're just getting those STL files and going straight to that. So reference the pictures so they know that they're in that files. So we're going to go upload those real quick, and then we'll let Harry go. We'll be done.